Hey guys, it's Laura, and as you can see, I'm still in Pittsburgh, still filming. I don't have a new background because I'm knocking all these videos out at once before I head to Morgantown tonight to speak. And in my last video, I explained, or my first video, I explained why I'm here, and I talked about what emails or letters do you need to send to your patients, and it made me think about one letter specifically that I want to address in a video all by itself, and that's dismissal letters to patients. So I see this all the time on social media where people are asking about dismissal letters and when to send them and do we have to send them all the time and all of that. And I have an opinion on it that I wanted to share with you guys. I'm not going to talk specifically in this video about what to put in a dismissal letter. I think that's state dependent and you have to check your state laws. So you need to find out, like, you know, how long you have to offer them emergency care, what needs to go in the letter. But that part you can find out and put together. I think you should have like a basic dismissal letter that you just use whenever you send to patients that meets your state laws. What I want to talk about now is that, do we need to send a dismissal letter to every patient? And I don't think we do. There are some times that you need to send dismissal letters, and that's really when the patients need to go, but they don't realize they need to go. And they continue to try to come in the practice. So a couple examples of that would be somebody who is continuing to come to you for hygiene. They're coming for their cleanings, but they're not getting their dentistry done, and their mouth is getting worse. Every time they come in, something more is going on that they're not addressing. If you continue to clean their teeth, but they don't do their dentistry, no matter if they sign forms that say you've presented it, but they're not going to do it, you are supervised neglect. You're cleaning their teeth, and then you're watching them get worse. So at some point, you need to draw a line in the sand and say, okay, you can no longer be a patient here if you are not going to take care of your mouth, and you need to decide for your practice when that is. But there needs to be a point where you say, you know, you cannot continue to come here and just get your teeth cleaned if your teeth are getting worse. Another one might be if you've got a patient who's rude. We had a patient who was inappropriate to our team members. We had one that was saying rude things to our hygienist. And he paid his bill and he came in and got his dentistry done, but we don't want a patient like that. So we dismissed him. So if you've got somebody who isn't playing by your rules or isn't appropriate with your team or just shouldn't be a patient in your practice, then you want to send them an official dismissal letter, because these are people who are still trying to schedule with you, but you don't want them to be in the practice. And remember, we don't have to be the dentist for everybody. You know, there are some patients who they don't fit our practice, and that's okay. They can go find another dental office that they fit, you know, that they belong in. Now, the flip side, my suggestion is not everybody needs to have a dismissal letter. There are patients who have fallen off the bandwagon with you guys, who have just kind of disappeared, and maybe they're just not patients that you want to bring back in anyway. I don't think that you need to send an official dismissal letter to those patients. If they've kind of just disappeared, just mark them inactive and let them go their merry way. More than likely, they're not going to call your practice again to come back in. And as long as you're not trying to reactivate them and bring them back into the practice, they're just going to kind of disappear, and that's okay. We don't need to send an official dismissal letter to those patients. Now, what if that patient calls back 2 or 3 years later and they want to get in because they have an emergency? My suggestion is you bring them in, right? You have not sent them an official dismissal letter, so you are still their doctor, their dentist, and I would bring them back in. We don't want anybody in pain. However, once you get the patient out of pain, I would find out or set the rules with them about your expectation of them as a patient in your practice. If they want, maybe things have changed for them. Maybe they're ready to take care of their mouth. Maybe they're ready to follow your rules. Great, then they can be a patient again, and we'll mark them active and they come back into the practice. However, if they don't want to play by your rules and they think they can only come in for emergencies and you've gotten them out of pain, now I would probably send them a dismissal letter. So that's my 2 cents on dismissal letters. I don't think everybody needs to necessarily get one. If you do, make sure that you check your state laws of what you put into them. Make sure that you know clearly if a patient is inactive, if they can come back or not, if they've gotten a dismissal letter or not. Don't bring them back in, but make sure that you are, you know, not trying to be the dentist for everybody, and understanding that at some point patients need to go, and either they need the official letter or they can just ride off into the sunset and we can part ways just fine without having to send the official letter. So there's my 2 cents on that. Check your state laws on your letters. Please put down below if you've got any other suggestions or ideas about this, and subscribe and send questions, because I only have one more video in Pittsburgh and then next week I'll be somewhere new and I want to make sure I address your questions. So thanks guys for listening. Have a super great day.